Hi everyone, and welcome to my presentation. My name is Dr. Shiva Hadadian, and today I would like to concentrate on the link between menopause and heart disease and how you can keep your heart healthy during menopause. So, let me share my screen. Okay. As you can see on the screen, our topic today is menopause and heart disease. So, what is menopause? Menopause is simply defined as a normal stage of a woman's life when the ovaries stop producing eggs and hormones. So, your menstrual periods stop permanently. On average, women reach menopause around the age of 51. Since the production of estrogen and progesterone in ovaries declines at menopause, you may experience many symptoms such as hot flashes, night sweats, sleep problems, mood changes, weight gain, and vaginal dryness. Studies have shown that postmenopausal women are at a greater risk for cardiovascular disease compared to premenopausal women. During perimenopausal years, estrogen plays a protective role for the heart. It relaxes the artery wall and promotes good cholesterol. Dropping in your body's estrogen level at menopause can increase your cardiovascular risk in the form of high blood pressure and high cholesterol level. Menopausal women are at even greater risk of cardiovascular disease if they also have diabetes, smoking habits, hypertension, high LDL, low HDL, obesity, sedentary lifestyle, or family history of heart disease. Diabetes is a kind of disease in which your body doesn't produce enough insulin or cannot use it efficiently. Insulin transfers glucose from the bloodstream into cells where it is used for energy. So, without enough insulin, glucose builds up in the bloodstream instead of going into cells. High blood sugar in people with diabetes has a bad effect on the heart. It damages blood vessels that supply oxygen to the heart and make these vessels susceptible to developing fatty deposits. It also harms the nerves that control your heart. In fact, heart disease is the leading cause of death among people with type 2 diabetes. Unfortunately, diabetes prevalence increases with age, so menopausal women are prone to diabetes. High blood pressure, known as hypertension, is a major controllable risk factor for heart disease. It puts a lot of stress and workload on the heart. Most people with hypertension are asymptomatic and they're not aware of their high blood pressure. Symptoms often occur many years later when damage to the heart has occurred. As you get older, your blood vessels' elasticity decreases and you are at risk of developing hypertension. Estrogen induces vascular relaxation and has a vasodilator effect. So, a drop in estrogen level as the result of menopause put you at risk of developing hypertension. The best way to prevent the consequences of hypertension is to check your blood pressure regularly. If it is high, try to control it with lifestyle changes and take the medication as prescribed by your doctor. High triglyceride levels, high LDL and low HDL cholesterol levels are associated with heart disease. Estrogen hormone causes a decrease in bad cholesterol or LDL level and an increase in good cholesterol or HDL levels. So a drop in estrogen level at menopause puts you at risk of developing heart disease. Obesity contributes to the development of type 2 diabetes, dyslipidemia, high blood pressure, and heart disease. The drop in estrogen level at menopause may lead to weight gain, particularly around the abdomen. So obesity is one of the factors that predispose menopausal women to heart disease. Smoking cigarettes promotes the formation of atherosclerotic plaques in blood vessels, and it is one of the main risk factors for heart disease. Smoking can also lead to early menopause and a higher risk of cardiovascular disease in menopausal women who smoke. So, what are the common symptoms of heart attack you shouldn't ignore? The American Heart Association lists chest discomfort in the forms of pressure, squeezing, fullness, or pain in the center of the chest, discomfort in other areas of upper body such as the jaw, neck, shoulder, or upper arm, cold sweat, shortness of breath, lightheadedness, nausea, or vomiting as the main symptoms of a heart attack. Screening helps to detect conditions that may lead to a heart attack. Screening also helps to find these conditions early on when they are so easier to treat. Measuring blood pressure is one of the most important screenings because while high blood pressure often has no symptoms, it can greatly increase the risk of heart disease and stroke. So it is recommended that you get your blood pressure checked regularly and get treatment if it is high. The US Preventive Service Task Force recommends that hypertension screening should be done every year in adults more than 40 years old and adults who have risk factors for developing hypertension. Menopausal women should also have regular screening tests for diabetes and cholesterol levels. The interval of screening depends on age, body weight, and other risk factors. Living a heart-healthy lifestyle during and after menopause helps in preventing heart disease. So try to eat a healthy diet, drink less alcohol, stop smoking, exercise regularly, meditate or use other techniques to reduce your stress and maintain a healthy weight. Make healthy food choices like low-fat dairy products, salmon fish, grapeseed oil, olive oil, fruits, okra, avocado, chia seeds, flax seeds, and leafy vegetables like spinach, and eat less saturated fats, which are found in butter, cheese, red meat, and other animal-based foods. Also limit your salt and sugar intake. Most of the salt in our diet is not from added salt at the table. Actually, it is from processed foods. A simple way to cut down on the amount of salt in your diet is limiting fast foods and using spices for flavor. And finally, HRT or hormone replacement therapy is a treatment used to relieve menopausal symptoms such as hot flashes. Using HRT has its own advantages and disadvantages, and it is one of the most controversial topics. At the moment, evidence is not sufficient to conclude that HRT improves cardiovascular outcomes in postmenopausal women, so it shouldn't be used for the primary or secondary prevention of heart disease. Thank you for your attention.